Have you ever noticed how one small area of your body can completely change the way you live your life? A few inches at the base of your spine may seem insignificant until every chair feels uncomfortable, every car ride feels endless, and every attempt to stand up reminds you that something isn't right. Tailbone pain has a quiet way of taking control. It doesn't always announce itself with dramatic symptoms, but it slowly begins to influence your choices, your confidence, and even your mood. What was once effortless suddenly requires careful planning, and simple daily activities become constant reminders of discomfort. The good news is that your story doesn't have to end there. Your body is designed to adapt, recover, and become stronger when given the right support. Healing is not about waiting endlessly for pain to disappear on its own. It's about understanding what your body needs and responding with patience, consistency, and the right kind of movement. Every positive action you take sends a powerful message to your body that recovery matters, and every small improvement becomes another step toward reclaiming the comfort and freedom you deserve. Today, we're going to explore practical tailbone pain treatment strategies and gentle coccyx pain relief exercises that can help reduce pressure on the affected area, improve flexibility, strengthen the muscles that support your spine and pelvis, and encourage healthy movement without placing unnecessary strain on your body. These are not extreme workouts or complicated routines. They are simple, effective techniques that almost anyone can begin with the right guidance and a commitment to steady progress. Remember, lasting recovery rarely happens through one big breakthrough. It happens through small decisions repeated consistently. A few mindful minutes each day can gradually become weeks of improvement, greater mobility, and renewed confidence. No matter how long you've been dealing with tailbone pain, today can be the day you stop allowing discomfort to define your daily life and start taking meaningful steps toward lasting relief, better movement, and a healthier future. Tailbone pain may seem like a minor problem at first, but anyone who has experienced it knows how quickly it can affect nearly every part of daily life. Sitting through a meeting, driving to work, watching a movie, or simply getting up from a chair can become uncomfortable and frustrating. Because the pain is located at the very bottom of the spine, many people assume there is little they can do except wait for it to improve. However, one of the biggest breakthroughs in recovering from coccyx pain begins with understanding why it happens and why the right kind of movement is often one of the most effective tools for healing. The coccyx, commonly called the tailbone, is a small triangular bone located at the base of the spine. Although it is much smaller than the rest of the spinal column, it serves an important purpose. It helps support your body when you sit, provides an attachment point for muscles, tendons, and ligaments, and contributes to balance and stability during movement. Because so many structures are connected to this small bone, even a minor injury or irritation can affect the surrounding muscles and joints, making everyday activities more difficult than they should be. There are many reasons why tailbone pain develops. A sudden fall onto a hard surface is one of the most common causes, often resulting in bruising or inflammation around the coccyx. Prolonged sitting, especially on hard chairs or with poor posture, can also place continuous pressure on the tailbone and irritate the surrounding tissues. Childbirth is another well-known cause, as the coccyx may be stretched or compressed during delivery. In some people, repetitive strain, muscle tightness, arthritis, or changes related to aging can also contribute to discomfort. Regardless of the cause, the pain often leads people to change the way they move without even realizing it. When pain appears, the body's natural instinct is to protect itself. You may begin leaning to one side while sitting, avoiding certain movements, or becoming less active altogether. Although these adjustments may provide temporary comfort, they often create new problems. The hips, lower back, and pelvis start compensating for the painful area, placing extra stress on muscles that were never designed to carry that additional workload. Over time, stiffness develops, muscles weaken, posture deteriorates, and movement becomes less efficient. Instead of solving the problem, avoiding movement can gradually make the body more sensitive and less resilient. This is why movement plays such an essential role in recovery. Healthy movement does not mean pushing through severe pain or forcing difficult exercises. It means choosing gentle, controlled activities that encourage circulation, improve flexibility, and strengthen the muscles supporting the pelvis and lower spine. Every time you move safely, blood flow increases, bringing oxygen and nutrients that help damaged tissues repair themselves. Flexible muscles place less tension on the coccyx, while stronger core and hip muscles improve stability and reduce unnecessary pressure on the tailbone during everyday activities. Movement also helps retrain the nervous system. After an injury, the body can become overly protective, interpreting normal movements as threats even after healing has begun. Gentle exercises performed consistently teach the brain that these movements are safe. As confidence grows, muscle tension decreases, posture improves, and fear gradually gives way to trust in the body's ability to recover. This combination of physical improvement and mental reassurance creates a positive cycle, where each small success encourages the next, allowing pain to lose its control while strength, mobility, balance, and everyday comfort steadily take its place through consistent, mindful, and purposeful movement. One of the most encouraging truths about recovering from tailbone pain is that relief does not always require complicated treatments or expensive equipment. In many cases, simple coccyx pain relief exercises performed correctly and consistently can make a meaningful difference. These exercises are designed to improve flexibility, strengthen the muscles that support the pelvis and lower back, reduce pressure on the coccyx, and restore comfortable movement. Rather than forcing the body through painful motions, the goal is to help it move naturally again, allowing healing to take place one step at a time. When tailbone pain develops, the muscles surrounding the hips, pelvis, lower back, and abdomen often become tight or weak. Some muscles work too hard to protect the injured area, while others become less active because movement has been reduced. This imbalance creates unnecessary stress on the coccyx every time you sit, stand, bend, or walk. Gentle exercises help restore this balance by relaxing tight muscles and strengthening weaker ones, allowing the body to distribute pressure more evenly instead of placing excessive strain on one small area. One of the most beneficial exercises for people with coccyx pain is the pelvic tilt. This simple movement gently mobilizes the pelvis and lower back while activating the deep abdominal muscles that support the spine. Performed slowly and with control, pelvic tilts improve posture, increase flexibility, and reduce stiffness without placing direct pressure on the tailbone. Although the movement appears small, its effects can be significant when practiced regularly. Over time, it helps the body move more efficiently and comfortably during everyday activities. Stretching exercises are equally important because prolonged sitting often causes the hip flexors, gluteal muscles, and piriformis muscles to become tight. These tight muscles can pull on the pelvis and alter the body's natural alignment, increasing discomfort around the coccyx. Gentle stretches performed within a comfortable range help release this tension, improve mobility, and reduce unnecessary stress on the tailbone. Deep, steady breathing during each stretch encourages the muscles to relax even further, making the movements more effective while promoting a sense of calm throughout the body. Strengthening the core is another essential part of recovery. The muscles of the abdomen, lower back, and pelvic floor work together to stabilize the spine and support proper posture. When these muscles become stronger, they absorb more of the forces created during sitting, standing, and walking, reducing the workload placed on the coccyx. Simple exercises such as abdominal bracing, modified bridges, or controlled leg movements can gradually improve stability without aggravating symptoms. The focus should always remain on quality of movement rather than the number of repetitions. Walking is another excellent exercise that many people overlook. Unlike prolonged sitting, walking keeps the body in motion, improves circulation, and encourages healthy joint movement. Even a short daily walk helps reduce stiffness while strengthening the muscles that support the hips and pelvis. As endurance improves, longer walks become easier, helping restore confidence in everyday movement while promoting overall physical health. The key to success is consistency rather than intensity. Performing gentle exercises for 10 or 15 minutes every day is often far more beneficial than doing an intense workout once in a while. The body responds to regular, positive movement by becoming stronger, more flexible, and better equipped to handle daily activities without discomfort. Every stretch, every controlled exercise, and every careful step contributes to a stronger foundation, allowing the coccyx to experience less pressure, the surrounding muscles to function more efficiently, and the body to move with increasing comfort, confidence, stability, and freedom from persistent pain. Recovering from tailbone pain is not determined by what you do once in a while, but by what you choose to do consistently every day. Many people begin their recovery journey with enthusiasm, hoping for immediate results. They perform a few exercises, make a few adjustments, and expect the pain to disappear within days. When that doesn't happen, disappointment sets in, motivation fades, and healthy habits are abandoned. Yet lasting relief rarely comes from quick fixes. It comes from building consistency, trusting the process, and allowing your body the time it needs to heal naturally. Every small effort may seem insignificant on its own, but together they create remarkable progress over weeks and months. The human body is designed to adapt gradually. Muscles do not become stronger overnight, joints do not regain flexibility in a single session, and inflamed tissues need time to recover. Every gentle stretch, every strengthening exercise, and every mindful movement sends a positive signal to your body. These repeated signals encourage healthier posture, improved balance, stronger muscles, and better coordination. Although the changes may not be noticeable from one day to the next, they accumulate steadily, creating a stronger and more resilient body that can better support the coccyx during everyday activities. Consistency also builds confidence. Tailbone pain often creates fear because people begin associating movement with discomfort. They become hesitant to sit, bend, walk, or participate in activities they once enjoyed. This fear can gradually limit their lifestyle even more than the pain itself. However, every successful movement performed without worsening symptoms becomes proof that the body is capable of healing. Each comfortable walk, each pain-free stretch, and each improvement in mobility strengthens not only the muscles but also the belief that recovery is possible. Confidence grows one experience at a time, replacing uncertainty with optimism. Another important aspect of consistency is developing healthy daily habits beyond exercise. Paying attention to posture while sitting, avoiding prolonged periods in one position, using supportive seating when necessary, standing up regularly to stretch, and maintaining a balanced level of activity all contribute to long-term improvement. Small adjustments made throughout the day reduce unnecessary stress on the tailbone and support the work being done during exercise sessions. Recovery becomes part of a lifestyle rather than a temporary routine. Patience is equally important because healing is rarely a perfectly straight path. Some days will feel encouraging, while others may bring temporary stiffness or mild discomfort. These fluctuations are often a normal part of recovery and should not be mistaken for failure. The body responds differently depending on activity levels, sleep quality, stress, and many other factors. Focusing only on occasional setbacks can hide the steady progress that is taking place over time. Looking back after several weeks often reveals improvements that seemed invisible from one day to the next. Celebrating small victories keeps motivation alive. Sitting comfortably for a little longer, walking a greater distance, getting out of bed with less stiffness, or completing a full set of exercises with improved control are all signs that the body is becoming stronger. These milestones deserve recognition because they demonstrate that consistent effort is producing real results. Every positive change reinforces the habit of caring for your body and encourages you to continue moving forward. Lasting relief is not built through perfection, but through persistence. Missing a day of exercise does not erase your progress, just as one good workout does not complete the journey. What matters most is returning to your healthy routine, staying committed to gradual improvement, listening to your body's signals, and trusting that each consistent choice brings you closer to greater comfort, stronger movement, renewed confidence, and the freedom to enjoy everyday life without allowing tailbone pain to dictate your possibilities.